Hi, my name is Rephael Berkooz, and today I'll be presenting on my APEX fellowship from this past summer, where I worked for the Wooster Community Hospital and the Department of Mathematics at the College of Wooster. So the Wooster Community Care Network is a program run by the Wooster Community Hospital, which began in 2014. Student health coaches take a course at the College of Wooster and then are paired with a patient in the WCCN. Health coaches meet with their clients once per week, keeping a record of their health goals, chronic conditions, and the lifestyle choices that impact these health goals and conditions. Students report this information directly to hospital staff. So I took this course in my first year at Wooster, and I've been an active health coach since the beginning of my sophomore year. Together, we serve over 200 patients in the Wooster area. So this past year, Scott Perkins, a senior health coach, approached Dr. Marion Frazier in the math department with ideas for researching the effectiveness of the program. So they did some initial research throughout this past school year, and then the research team was expanded with the addition of Dr. Brooke Krause in the economics department. They received a grant to support some economic research by Shivam KC, a math student at the college, and then I was brought in kind of last minute due to COVID preventing travel to my previously planned internship. But with my knowledge as a health coach, we expanded the scope of our analysis to include the impact on chronic conditions and overall health for patients, which was something that was definitely in my area of personal expertise. So I spent a lot of time reviewing relevant literature for research. This meant kind of going through papers and analyzing the important similarities and differences between what other people in the field were doing, what kind of questions they were asking, and what kind of questions that we wanted to ask. This gave me a sense for what methods other researchers use to answer questions similar to ours. And from my literature review, I also worked to identify relevant data that we could use to ask broader and more important research questions. There was a good amount of data manipulation, which I was fortunate to have some coding background, which made it a lot easier. And this enabled us to make really kind of good and clear-cut models that effectively evaluated the WCCN. So having worked in a wet lab previously, like a hands-on biological lab, it was really refreshing to be able to see and understand the entire scope of the research, not just a small part. And this was really due to the fact that every part of our research process was accessible to me through literature and software. I was able to do the entirety of my work remotely. So my summer experience, I would say, was incredibly impactful for me. In this unique opportunity, I was able to bring together my personal interest in public health with the quantitative skills that I picked up in my classes. Having been a part of the data creation from my time volunteering, analyzing the impact that our larger organization made on people's lives was very moving. I was able to see the behavioral changes that I helped cultivate translate to quality of life and health improvements for the patients, which then further translated to savings and reducing the financial burden for patients and the hospital. Honestly, my interest and commitment to the health coach program was really declining leading up to this summer, but the internship experience kind of really reinvigorated me. It really demonstrated the importance and the learning opportunity that the health coach program has played in my life. Overall, this APEX fellowship has taught me so much throughout the application and planning process, and through the internship itself. Prior to finding a spot on this research team, I actually intended to work for a tech startup abroad. This fell through with the COVID travel restrictions, so I really had to scramble to find a local or remote opportunity. I was in communication with Kathy McConnell at Apex, who connected me with Dr. Fraser, who I knew from my major department. While I was hoping to leverage different quantitative skills this summer, this overall experience fit really well with her research goals. I ended up learning a lot, contributing a lot, and I got so much more out of my summer than I ever expected. However, I did struggle throughout the summer with the bureaucracy and restrictions that center around, they're placed on patient-level medical data. I really wanted to get as much research done as possible, which was pushing me to make demands of our partners over at the hospital. Eventually, I learned the importance of maintaining professional relationships and expectations between organizations, as it was really crucial to understand that my actions in the early stages of a research partnership, my actions both determine and impact the future of the research partnership. It was really not something to sacrifice for short-term productivity. So when I originally applied for Apex funding, I was contracted to work for a startup developing algorithms and computer vision systems for autonomous driving and simulations. Obviously, this changed drastically with travel restrictions, as I would have had to wake up at 3 a.m. to account for the time distance when working remotely. This was a huge surprise for me, as it was for all of us. And so while I kind of kept this extreme option open, I began branching out and asking around to possibly find an alternative. So fortunately, I was able to reach out and find this opportunity, but I think it's very important that, especially with the uncertainties of COVID and politics and these types of things, it's a good idea to keep as many options on the table as possible and never stop looking for opportunities. For students looking to find opportunities similar to this, I have two main pieces of advice. The first is to look within activities and things that you already do. Learning from Scott's example, he wanted to study more about an activity he was already participating in, and by doing so, he made an opportunity for himself within the college. The second, I would say, is reaching out and relying on your personal network. This was how I guess I ended up with this opportunity. So professors in your major and alumni with a similar background are going to have the best opportunities for you, especially within your area of interest. So thank you so much for listening to my presentation. Feel free to leave a comment with any questions or feedback, and make sure to follow Apex on Facebook and Instagram. Thank you so much.